And the minute that you decide to let a brother go up and you unprotected, that's the minute that you decide that brother's worth your life. And your wedding ring, baby, it's not a condom. So that means women our age, we are becoming infected. It's the #1 killer among African American women. Any species, I don't care what it is. It could be a rabbit. When you start killing off the women of that species, that means you're making that species extinct. One day, if we don't put a lid on this epidemic, one day you're going to go into the museum, and it's going to be a person standing there, and they're going to tell you, it was an African American woman, she had kinky hair, she no longer exists because the HIV virus wiped that species out. So we as women, we got to step up and we got to start taking charge, and we got to be responsible for our actions and make our brothers know it's not an option. So you and your husband are still together? Mm-hmm. Okay, so no cheating or anything?
Not with me.
Okay, so you don't know if he's cheating?
He locked up.
Oh, okay. Okay.
On top and just swipe it around. That's it.
The results came back negative.
I know.
That.
Yes, America, I am negative once again.
All right, that was actually a happy moment there.
Yeah, right. But you know, too many of us go around and doing this like after the fact. You know, like you have you be tiptoeing around with somebody, and you go get your test the next day or like a week later, and praying that the thing's going to be negative, and that doesn't work too long. Literally, it's like playing with a loaded gun. In fact, I've started to think about this whole thing. Like, it is like we used to talk about young men with guns, and we still do, sort of like, it's like we expect to die, so what difference does it make whether we're dying from a gun or we're dying from AIDS or whatever? It does make a difference because we're affecting our whole communities like this. So
Okay.
that young woman that was doing the testing, Tony, she's a trip. She's actually now decided that she's going to go into the prisons and start working with young men in prisons, because she says if you can't get the brothers to understand why wearing a condom is so necessary, that we're never going to be able to stop this thing.
Okay. Now, usually I do a segment with a young man that's been locked up for the last 21 years. This just happened to be one night that he didn't call in, and he made a statement, and that is that every woman that has a man in the penitentiary, even if he's just locked up in the county lockup, should get an AIDS test before she sleep with him ever again.
Yeah, that would probably be true, because, this thing, the virus, like if you sleep with somebody last night, you go get a test tomorrow, you don't really know whether or not you got that virus or not. You got to wait for 30 days. It takes your body like 30 days to realize that it's been infected with this thing. So you really got to sort of watch that. It's not like you can go the next day. It's not like you can go get a morning after pill or you got the class or something. You can just go get a pill and deal with it. You got to wait for the thing to show up in your body. Then you got to go get tested, and you need to wait a couple of more months to go get tested again. I would agree with what that brother said, that you can't really trust, because there's different reasons why something may go off in prison. A man ain't necessarily on the down low just because he has sex with some man in prison. There are a whole bunch of reasons why something like that could happen. Yeah. So it's important that we not be judgmental and just sort of be proactive about protecting ourselves.
Okay. Now, if there was something that you could tell the people about this film that would really make them want to see it, what would it be?
What?
I said, if there's something...
It's like they trying to kill us. It really does begin to feel like genocide. You have no access to medical care. You can't get a job, so you don't have no insurance. You can't afford to put gas in your car to go see the doctor. There's so many things that are combining to make us vulnerable to this thing. And then, like folks, or like our older generation don't want to talk about anything having to do with sex, God forbid. And the younger people are all into sex. And then they teach abstinence only in the schools. So this is crazy. This country is just insane about how it's not dealing with this situation. And as Tony was saying in that clip, black people are going to become extinct if we don't start dealing with this thing. Because the two largest categories of people that are getting this are now young black women, 18 to 24, and then women who are over 50. So they're killing off the women that can bear the children, and then the elders that we need in order to sort of guide us through in the community, they're dying too. So we really got to wake up and deal with this thing.
Okay. Now, can you tell the people where and when possibly they'll be able to connect to see this?
Not yet, because I'm in the middle of we got this thing online called a Kickstarter campaign. I'm trying to raise some funds. So if you go to our website, which is publichealthprivatepain.com, it's all one word, you can sort of click on it and it will take you through the steps to help us donate. I'm trying to get it finished by the end of the year, but that will really depend on how much money I can raise.
Okay. Okay. Now, as we get ready to close out this interview, I want to first thank you for giving us the first exclusive to this. And
thank you, Hodo.
Secondly, I want to give you the open door policy that any time that you want to come back, and especially when you come into the city of Detroit, I would like to get you live in studio if it's at all possible. But anytime that you want to come back and discuss this and bring it to the forefront, you have an open door policy from yours truly.
Okay, well, thank you so much. I'll take you up on that.
Okay, well, I want to show one more clip before I let you go.
Okay.
And this one is kind of hard hitting, so I want the people to really get ready for it. This is another clip from the film, Public Health, Private Pain.
HIV is one of these diseases that we cannot sugarcoat.
That's right.
And that is part of the problem. We've been sugarcoating this for too long. Oh, the vagina. If I came in here and said, oh, the vagina and the peanuts and, the semen, you're not going to remember. Right around there don't mean that it's too little. Now, I'm going to tell you when to know that it's too big. Every time you go in and out of woman and you go in and you come out and it's staying in, brother, it's too big.
Okay. No time for condom?
No time to put a condom on, and also it's going to disturb the mood.
A condom and a dick should go. You shouldn't whip it out unless you're using the bathroom. You shouldn't whip it out planning on doing nothing and ain't got a condom. If you're holding it in your right hand, you should have a condom in your left hand.
I think that, when these things about the condom don't want to use them, I think it's more mental than physical. Because if you go into something thinking it, it's going to happen.
I rolls up to the liquor store all over in Georgia. Damn, here come Tony with them damn condoms. Come and get them! Call me the condom lady all you want. It might be your life. That I just said.
That's right.
That's right. I agree.
Because guess what? When I was hoarse, you called me the whole. Hey, I've been called worse things than the condom lady, baby. I own it.
All right. We got a call calling in, June.
Mm-hmm.
Let's see if we can take one call before we get out here. And before I take this call, I got to give props to Max Eve Public Relations, because this particular entity is the one that set up this interview and a lot of the interviews that we get here on the Hodo Show and the Other Viewpoint. So we want to give props to Max Eve Public Relations all the time.
Yes, all props to the Max.
Okay, whoever it was, they hung up. All right. Well, June, thank you very much. And if there's anything else that you want to say before we close out, now's the time.
Well, the film is going to tell the story of this one family, but the clips that you're seeing online are sort of the teasers. So I encourage everybody to go to publichealthprivatepain.com. You can see some of the clips. You meet some of the characters, the family that we're actually going to be profiling. We profile a family, and then we're profiling this group of advocates that you've heard from Tony in these clips. So it'll be the story. The film will tell two stories. So publichealthprivatepain.com.
All right, that's publichealthprivatepain.com. Thank you, June. I appreciate you.
Okay, thank you.
All right.
All right, bye-bye now.
Bye. This is, of course, the Hodo Show and the Other Viewpoint. And, we hit the serious topics here from time to time, and it's necessary. So don't get scared. Stay locked in, because now we're going to lighten the mood a little. we have waiting in the wings these ladies by the name of Unique, and guaranteed and certified they're going to give you something that's specially unique for you. So don't touch that dial. We'll be right back. This is, of course, the Hodo Show and the other viewpoint. And I, yes, I am your brother, if there is no other. I'm Hodo. Who are you? This is Hodo reminding you to catch the Hodo Show and the other viewpoint at our new time, Sunday from 10 to midnight, for the very best in radio music and some of the most in-depth topics around, right here on your community radio station, 88.1 WHPR. I'm Hodo. Who are you? You're listening to.
You're listening to.
You're listening to
You're listening to
the Hodo Show
on 88.1 FM.